right now. Good, okay. Okay, so she's been laying on the foam, and I'm going to pull it out. It's 3 by 5. I'm sorry, it's 3 by 4 by 8 inch foam. It's kind of half round. Let's have you lay on your stomach. So I'm capturing your PSIS and part of the ilium above and below. I can now load it. I can spring it, okay? And looking at your sacrum is now, it's no longer deeper than the PSISs. It's come back. It's actually level with them at the S2 level. I'm going to try and spring the sacrum now. I can load it. And I can give it a little spring and you see it bounce right back. So we now have sacral mobility. This is our tailbone. This is the ILA of the sacrum. Sacrotuberous comes from the sacral ILA to the ischial tuberosity. So I strum it perpendicularly. There it is. I'm on it. And I can indent it slightly and I can spring it. It has a little tiny bit of spring. It's sort of like a 3/8 inch taut nylon rope. Let's have you, we'll keep filming. Let's have you step down and walk around. You're laughing.
Yeah, because it feels weird. It feels good.
Feels weird, but good.
Yes.
Okay.
Yes.
Well, that's me. That's, you're describing me every day of my life.
Oh, yeah. Yeah, it feels really good.
Tell me,
Because I feel like there's less tension in my pelvic area, and it just seems easier to walk.
Okay. Would you check the space in the front, please?
Oh, it's shorter. It's smaller. It's still, a little bigger. But again, that was 40 years ago, and I definitely gained weight. But it's smaller. It's smaller.
Okay. So somehow there is some kind of malleability that's available.
Yeah.
And people debate about how much movement is in the SI and how much is in the pubic joint because they move together.
Mm-hmm.
And I've chased the literature. I'm aware of what's out there. I'm also aware of outliers, and you are an outlier in which your mobility could very possibly be greater than the average person, your age, size, body type, etc. If there's a better explanation for this phenomenon, I'm all for it. It just hasn't been forthcoming. Let's have you sit in this chair now.
Mm-hmm.
And just tell us what sitting is like.
That's not more comfortable.
Elaborate.
Before I felt like my hips were too far apart.
And you said that earlier. Yeah.
It's more comfortable to sit. It doesn't.
Do you mean your sit bones felt far apart?
I don't know.
Or somewhere else in your pelvis?
I'm not exactly sure where.
In the front of your pelvis or in the back of your pelvis?
Sort of it. Again, I don't know. Like right in my crotch, kind of right there. I felt like it was too.
Okay.
Apart.
So here's the deal. Okay. I would submit to you that was the lower pubic joint. Okay.
Okay.
So this is the pubic joint. It's a vertical joint, vertical structure, and I would submit to you that the lower part of it was possibly separated like that.
Okay.
That's actually three-dimensional movement. And given what was happening with the sacrum and the ilia, it probably was forward and I don't know. I think the first one, is more descriptive. Does that sound like what you were experiencing?
Yeah, it does.
Yeah, very good. And when we treat movement in one plane in this pelvis, it does move in three planes of the body. So I'm encouraged with this. I can't imagine your sacrum moving back into your body like it seemed to be.
Oh, good. Well, that's good.
So this is what we call a once and done.
That would be amazing. That would, yeah.
Very good. Well, I'm delighted. Whatever it is, you know, and someone's going to tell me I'm wrong, and here's the research, and this is what really happened. And I'm like, that doesn't exist.
Yeah,
That's a fantasy. No one can prove what really happened in your body.
Right. Yeah, I don't even know. It's my body, and I don't know what happened.
Right,
really.
right.
Yeah.
You know, and I think muscle can get really tight like your pelvic floor, and there is research that has validated that bony deformation happens in the pelvis. Well, yes, an ilium is a deformable structure, and guess what? It's remarkably thin right in this mid-region of it. And they've demonstrated that muscles pulling on the ilium can, in fact, deform the bone. So that could be a piece of this. You might have a little extra SI movement on each side. You might have a little extra pubic joint movement. And you may have unique anatomy, such that all of that adds up to you being one of those outliers. It doesn't fit the box of the average woman like yourself who gave birth. So I'll tell you what, I'm going to stick with my SI and pubic joint explanation.
That sounds right to me. It does, yeah.
Yeah, I mean,
Definitely
you know,
does,
doctors
yeah.
look at women and say, oh, how many children? They're looking at the width of your pubic joint. It alters shape in response to childbirth.
Right.
So anyway, I'm yammering and I'm going to stop here, and thank you so much.
Thank you.